Have you ever been told that you're double jointed? Maybe your elbows bend backward, your knees hyperextend, or you can easily place your palms flat on the floor without even stretching. Perhaps you've always been the flexible dancer in class, the one who could achieve oversplits, high extensions, or seemingly endless turnout. If so, you may be hypermobile. In ballet, hypermobility is often viewed as a gift. After all, flexibility is highly valued in dance. Many dancers spend years trying to increase their range of motion, while hypermobile dancers may appear to possess it naturally. But the relationship between hypermobility and ballet is more complicated than it seems. While hypermobility can provide certain advantages, it can also create unique challenges that affect technique, performance, and injury risk. Today, we're going to explore what hypermobility actually is, why it's so common in ballet, the benefits and challenges it can create, and most importantly, what hypermobile dancers can do to stay healthy and perform at their best. I'm Caroline Simpkins. I'm a former professional ballerina with a PhD in biomechanics, and today we're discussing hypermobility and ballet. Let's start by defining what hypermobility really means. Hypermobility refers to a joint's ability to move beyond what is considered a typical range of motion. Many people use the terms flexibility and hypermobility interchangeably, but they are not exactly the same thing. Flexibility generally refers to the range of motion ability of muscles and other soft tissues. Hypermobility, on the other hand, is more closely related to the connective tissues that support our joints, including ligaments and joint capsules. A person with hypermobility may be able to bend their thumb to their forearm, hyperextend their elbows or knees, or achieve joint positions that others find difficult. One commonly used screening tool is called the Baton score, which looks at several joints throughout the body and assigns points based on the presence of generalized joint hypermobility. It's important to understand that the Baton score is simply a screening tool. It does not diagnose a medical condition. And that brings us to an important distinction. Not everyone who is hypermobile has a disorder. Many people have hypermobile joints and experience no pain, no instability, and no limitations. They simply have more joint mobility than average. In fact, many dancers fall into this category. However, some people experience symptoms that go far beyond increased flexibility. This is where conditions such as Ehlers-Danlos Syndrome, or EDS, enter the conversation. EDS is a group of inherited connective tissue disorders that can involve joint hypermobility, but it is much more than simply being flexible. Depending on the type and severity, individuals may experience chronic pain, frequent joint dislocations or subluxations, easy bruising, skin changes, fatigue, and a variety of other symptoms affecting multiple body systems. In recent years, awareness of EDS has increased dramatically, particularly through social media, and many dancers have begun wondering whether their hypermobility might indicate an underlying connective tissue disorder. The important takeaway is that hypermobility and EDS are not the same thing. Many dancers are hypermobile without having EDS, while some dancers do have EDS or another hypermobility-related disorder. If someone experiences persistent pain, repeated injuries, frequent joint instability, or other concerning symptoms, it's worth discussing those concerns with a qualified healthcare provider that is familiar with hypermobility disorders. For today's episode, we're going to focus primarily on hypermobility as a physical characteristic and how it interacts with ballet training. Now let's talk about why hypermobility appears to be so common in ballet. One reason is that ballet often rewards the physical traits associated with hypermobility. Dancers with naturally mobile joints may achieve greater turnout, higher extensions, deeper back bends, or more aesthetically desirable lines with less effort than their peers. As a result, these dancers may stand out during auditions, gain positive attention from teachers, and find success early in their training. In other words, ballet may naturally attract hypermobile individuals, and the ballet world may unintentionally select for those characteristics. Now, there are certainly benefits to hypermobility in dance. Increased range of motion can contribute to beautiful lines, expansive movement quality, and technical capabilities that are highly valued in classical ballet. Audiences and judges often admire extraordinary flexibility, and there is no denying that hypermobility can sometimes create striking visual effects on stage. However, mobility is only one piece of the puzzle. Mobility without stability is just instability. Every joint in the body needs a balance between mobility and stability. If a joint is extremely mobile but lacks adequate stability, the surrounding muscles must work harder to control movement. In hypermobile individuals, the passive structures that help stabilize the joints may provide less support, which means the active structures, primarily the muscles, have to pick up the slack. And this is where some of the challenges begin. Many hypermobile dancers are surprised to learn that flexibility itself is not always the limiting factor in their performance. Instead, they may struggle with control. For example, a dancer may have more than enough range of motion for a beautiful arabesque, but find it difficult to maintain alignment throughout the movement. Another dancer may have extraordinary foot flexibility, but struggle to stabilize the ankle during releve or landing from jumps. Balance can also become more challenging. Maintaining stability on one leg requires the nervous system, muscles, and the joints to all work together efficiently. If the body has difficulty sensing joint position or controlling excessive movement, balance tasks may become more demanding. And this brings us to another important concept, proprioception. Proprioception is your body's awareness of where it is in space. It's sometimes called your sixth sense. Without looking, you know where your arms and legs are positioned because your nervous system is constantly receiving information from receptors throughout your muscles, tendons, and joints. Research suggests that some hypermobile people may have reduced proprioceptive awareness. This doesn't mean they can't become excellent dancers. Far from it. But it may mean they need to spend more time developing body awareness, balance, and neuromuscular control. And another challenge is injury risk. While hypermobility does not guarantee injury, some studies have found associations between hypermobility and certain musculoskeletal problems. Dancers may experience recurrent ankle sprains, tendinopathies, joint pain, or just general feelings of instability. When joints move beyond their optimal range repeatedly without sufficient muscular control, tissues can become overloaded over time. For dancers with Ehlers-Danlos Syndrome or other symptomatic hypermobility disorders, these challenges can be even more significant. A dancer may possess extraordinary flexibility that is praised in the studio while simultaneously dealing with pain, fatigue, instability, or recurrent injuries that aren't visible to teachers or audiences. This can create a complicated relationship between ballet aesthetics and long-term health, making individualized training and healthcare guidance especially important. In ballet, there are several common technical issues that can arise in hypermobile dancers. One example is knee hyperextension. Many dancers have naturally hyperextended knees, and in some cases, this contributes to the long leg lines often admired in ballet. However, constantly forcing the knees into their maximum hyperextended position can reduce muscular engagement and place additional stress on the joint structures. Learning how to control the knees rather than simply locking them can be an important skill. Another example involves the feet and ankles. Hypermobile dancers often have highly flexible feet, which can create beautiful point lines. However, that same mobility may make it more difficult to maintain stability and alignment. Excessive sickling or rolling the ankles can sometimes become a problem if adequate strength and control are not developed alongside flexibility. And turnout can present similar challenges. A hypermobile dancer may have enough flexibility to place the feet in an impressive position, but if that turnout is not originating from the hips, compensations can occur at the knees, ankles, or feet. The appearance of turnout is not always the same thing as functional turnout. So, what should hypermobile dancers do? Perhaps the most important thing is to shift the focus from flexibility to control. One of the biggest misconceptions in ballet is that more flexibility is always better. In reality, ballet is not a flexibility competition. Ballet is a movement skill. The goal is not simply to get your leg higher, it's to control where your leg goes, how it gets there, and how safely and consistently you can repeat the movement. Many dancers spend years asking, how can I become more flexible? But for hypermobile dancers, a better question may be, how can I better control the flexibility I already have? And strength training is one of the most effective tools available. Developing strength in the hips, core, calves, and feet can provide the active stability needed to support hypermobile joints. This doesn't mean building large muscles or sacrificing artistry. It means developing the strength necessary to move both efficiently and safely. Balance training can also be extremely valuable. Single leg exercises, relevés, dynamic stability drills, and proprioceptive training can help improve joint awareness and control. These types of exercises teach the nervous system to better coordinate movement and respond to changing demands. For some hypermobile dancers, reducing excessive stretching may even be appropriate. This can sound counterintuitive in the ballet world, but more range of motion is not always the answer. If a dancer already possesses more than enough mobility for the demands of ballet, additional stretching may provide little benefit. In many cases, strength, stability, and motor control become the priority. So ultimately, hypermobility is neither inherently good nor inherently bad. It is simply a physical characteristic. Like any physical characteristic, it comes with both advantages and challenges. Some hypermobile dancers enjoy exceptional flexibility and beautiful lines. Others may struggle with instability or injury. Most experience a combination of both. The key is understanding your own body and developing the tools necessary to support it. The most successful dancers are not always the most flexible dancers. They are often the dancers who can control their movement with precision, consistency, and confidence. Flexibility may create opportunity, but strength and control are what allow dancers to use that flexibility effectively. Thank you again for tuning in, and I look forward to seeing you next time on the Ballet Science Podcast.